workers' compensation.
It was like a version of Shark Tank on a local level. 7 health startup companies pitching their commodities to a group of more than 150 potential investors, industry leaders, and technology executives at the Rockville Innovation Center.
Who is Glucose Mama? What is Glucose Mama?
Glucose Mama is the first digital therapeutic system for gestational diabetes.
After 5 months of hard work, these select entrepreneurs brought their creative minds to the stage in hopes of being discovered as the next tool in the healthcare industry.
So GastroGirl is actually the first patient-centric telehealth platform that brings all the key elements of support to patients with gastrointestinal issues and conditions.
Jacqueline Gallen started GastroGirl as a blog in 2007. She's worked for the American College of Gastroenterology for the past 6 years.
I want to show you the 3 key aspects of this. Here, patients can find a registered dietitian with gastrointestinal expertise, with digestive health expertise. I had this vision of making this come to fruition as more of a support system for patients. And I was fortunate to be accepted into Relevant Health Accelerator, where I could actually build out the platform to help patients.
There's so much information out there that's not validated. It's not something that is really geared towards the patient. Sometimes it's frightening, sometimes it's to sell a product. GastroGirl would be a validated portal where patients can come and feel comfortable to discuss things and get information like gluten intolerance, or what it means to have irritable bowel syndrome, what is bloating, what is gas, things that they might not feel as comfortable or have as much time to discuss with their healthcare provider.
The companies were chosen out of a field of 80 applicants. Each was awarded $50,000 in funding to develop their product.
Welcome to GastroGirl. And in case you're wondering, we unveiled our site this morning, and the first 2 people to sign up were men.
The 5-month program is intense. The curriculum is designed to give the entrepreneurs the skills to develop and launch a viable health tech product.
Final piece that I want to show you that's really also very cool is our telehealth platform.
Relevant Health partnered up with the county's Office of Economic Development, BioHealth Innovation, and Product Savvy to put on the event.
During the interview process, you kind of shake your head and say, I don't know if this is going to make it. And then we had a midterm presentation. We said, oh, they've come a long way. So I'm anxious to see how they come out today.
My congratulations to you.
Well, you look at our assets here. You look at NIH, you look at FDA, you look at the interaction that needs to occur between companies and their regulators and their funders. There's a workforce here. We have something like 5,000 postdocs in the STEM field who are willing and interested pipeline of researchers and employees for these companies. So it's a logical fit.
Council President Nancy Florine says programs like this are key in growing the county's economic base.
Montgomery County is all about innovation, and it's all about creativity, and it's all about creating a safe place where people can explore ideas and hopefully bring them to market. But it is a real statement to the business community of how we're there for them, and it's a great statement to our community generally about how we want to be in the forefront. We want our people to be successful, and we want to find avenues that are affordable and give them access to the tools they need to really create their own pathways to the future.
After learning that 3 million babies die in their first month of life each year, Teresa Caubbell and Sona Shaw began working on Neopenda as graduate students in the Biomedical Engineering Department at Columbia University.
600,000 newborns in Uganda alone are in need of care from complications that happen at or around birth. We've developed a vital signs monitor that can measure heart rate, respiratory rate, blood oxygen saturation, and temperature, all integrated into a baby hat. And so the vital signs are wirelessly transmitted to a tablet. And so this is what it would look like if there are 8 babies in the room. So all of the vital signs are displayed, and if any of them go out of range, then they start flashing like you see right here. If any of the vitals go out of range, then the nurses are alerted.
We want to deploy a technology solution that will boost the impact of a single healthcare worker in an understaffed hospital.
This team recently spent time in Uganda doing market and user research.
We've both been passionate about global health for a long time, and we sort of came up with this idea while we were in a design course as grad students at Columbia University. And so this started as a project in the class. We started talking to different stakeholders in places like Uganda and doing research on this problem, and sort of came to this solution of a vital signs monitor.
And thank you for your time and support.
And the fact that you went through this rigorous process to get into this program, what are your hopes today?
Oh gosh. Well, this is like a huge turning point for us to get to the end of Relevant Health. We're really happy to have our MVP, our product here to start testing and to start doing studies with. So we're kind of at a really cool acceleration point.
After Demo Day, the Neopenda team started a Kickstarter campaign that raised $13,000 in 48 hours. And the other companies are all in discussions with potential investors and partners. Relevant Health plans on launching its second health tech accelerator this fall. For more information, visit their website at relevanthealth.md.